everyone. I'm Hank Clear with Financial Strategies Group, and our commitment has always been to give more than just investment advice. Because your financial plan has multiple parts that need attention, we like to bring in some of our subject matter experts to really take a deep dive into specific areas. Today, we're fortunate to have Jan Knight to educate us on Medicare planning as we approach age 65. To give you a little background, Jan's been in the financial services industry since 1992, and since 2005, she has specialized in assisting clients with Medicare and Social Security decisions. And her goal is really to help clients maximize their government benefits. Now, during our presentation, we won't be able to take questions, but of course, we'd be happy to follow up with you after the presentation. So, Jan, welcome, and I'll turn it over to you.
Thank you so much, Hank. It's a pleasure to be here. I've been looking forward to spending this time. I love talking about Medicare, and so we're going to spend 30 minutes talking about the basics and walking through what you might expect if you are looking to sign up for Medicare or coming into that period. We're going to start off. Medicare, as you know, is a government program. It's for people who are 65 plus. Some people think that Medicare has been around for a long time, but it's actually only since 1965. President Johnson is the one who signed that into law, and Social Security was way back in 1935. So it's interesting, Medicare hasn't been around that long. It is administered by CMS, the Center for Medicare and Medicaid Services, but you have to sign up through Social Security, and you're billed through Social Security. So that's always tricky for some people about when it comes to first sign up. Who is eligible for Medicare? Well, anybody who's 65, if they are a U.S. citizen. As a matter of fact, you don't have to be a citizen. If you're a legal resident for at least 5 years, you're eligible for Medicare, as well as people who have been disabled. Someone who is receiving Social Security disability, once they are on disability for 2 years, they automatically are enrolled in Medicare. So there's 4 parts to Medicare. Most people have heard of A and B. Original Medicare is Part A, which is hospitalization. Part B is medical. Medical insurance would be doctors, outpatient procedures. It would be labs, medical equipment, basically anything that happens outside the 4 walls of the hospital. And we have Medicare Part C. Medicare Part C and D we'll talk about also. Those are done by private insurance companies. So Medicare Part C actually takes the place of Medicare Part A and Part B. That's called Medicare Advantage. And that's the ads that you see all the time. That's the Joe Namath programs that you see all the time. And you're going to see a lot more of them because we're just about in an annual enrollment period. Part D is prescription drug plans. That also is done through a private insurance company. So what does Medicare cover? Well, it covers 100% of the first 60 days. We're going to talk specifically about that in a minute. It covers 80% of Medicare approved amounts for the medical services. You're responsible for 20%. It covers a lot of preventative services, some preventative services. It covers a lot of preventative annual services. Now, to get into some specifics, with Part A, the hospitalization side, someone is in the hospital, the first 60 days, they have a one-time deductible of $1,484. That's for the first 60 days. If they're still in the hospital, day 61, they start paying a daily copay of $371. If, God forbid, they're still in the hospital, day 91, they start paying a daily copay of $742 a day, which, as you can figure, adds up to be a lot. Part A also is for skilled nursing care. That is care that someone would receive after being hospitalized. And we'll talk a little bit more about that in a minute, but to just know that Medicare covers 100 days of skilled nursing care. It covers 100% of the first 20 days, but it only covers 80% of the next 80 days. So there are copays there as well. It does cover hospice, and it covers all but the first 3 pints of blood. Now, if we look at Part B Part B has an annual deductible. This year it's $203. Goes up a little bit every year, but this year it's $203. That comes off the top. No matter what plan you're on, you're going to pay the $203 deductible. After that, Medicare pays 80% and you're responsible for 20%. So that also covers, it covers labs, as we said. When it says home health care, that it covers home health care, that is very limited in scope. The only time it covers home health care is when someone's been hospitalized or needs to have bandages changed or physical therapy at home, something like that. That's one of the only type of home care it will provide. It does cover 100% of outpatient, and it was said, and the blood. Sorry, I got ahead of myself there. So the important thing to know about Medicare enrollment is you have to sign up when you need to sign up to avoid late enrollment penalties. And those penalties can be significant, and they're also permanent. So someone who doesn't sign up on time when they turn 65, and we'll talk about that, not everybody has to, but someone who doesn't sign up gets penalized 10% per year for each year that they're not covered by Part B. And that is true of the prescription drug plans as well. For someone who doesn't get a Part D plan, the prescription drug plan at age 65, they will pay 1% per month for each month that they don't have the coverage. And again, that is a permanent penalty. So the important thing is to sign up when it's appropriate for you. In addition to the late penalties you may incur, Medicare enrollment creates windows of opportunity to get insurance to cover those gaps and copays that we talked about. If you don't sign up at the correct time, the correct window, you may not be able to get that insurance that's going to cover those deductibles and copays that we talked about that can be very expensive. Now, you enroll in Medicare. If you are 65 and you're on Social Security, you will automatically be enrolled in Medicare. They send you your card. The coverage is going to start the first day of the month that you turn 65, and that is automatic, but Part C and Part D are not automatic. It's really important to understand that when it comes to Medicare, to sign up and to make changes, you have to have a golden ticket. You have to be in an enrollment period to be able to qualify. And by that, so there are a few. Your initial enrollment period is when you turn 65. A special enrollment period could be several things. One is if you continue to work past 65 and you stayed on your group health insurance plan, at the point that you go off of that plan, you have a special enrollment period. You can sign up for Medicare then. There's also a general enrollment period. If someone missed their opportunity, missed their golden ticket, every year it comes around again at the beginning of the year from January to March. But the problem with the annual enrollment period is that you sign up between January and March, but your coverage is not effective until July. So that's definitely not an option that we want to take. So it's just important, the principle to know, you do have to have a golden ticket of some kind to sign up or make changes for Medicare. Now, the initial enrollment period, when we go back to that, the initial enrollment period is the 7 months around your birth month. So it's the 3 months before your birth month, the month of your birth month, and the 3 months after. During that time, you can enroll at any point during that time. Your coverage, if you do it the first end, is going to be, if you do it before your birthday, it's effective the first of the month of your birthday. If you wait and delay that, then it's going to be effective the first of the following month. Who signs up for Part A during the initial enrollment period? Well, pretty much everybody who turns 65, unless they are working and their employer has more than 20 employees. If your employer has 20 employees or less, then you're obligated to sign up for Medicare when you turn 65. If they have more than 20 employees, you can choose to sign up for Medicare if that's a better option for you, or you can continue on your group plan, and when you retire or leave your work, then you can go on Medicare. Interesting thing is, even when you're 65, if you continue to stay on your group plan, you can choose to sign up for Medicare Part A only. What that does is it kind of creates a backstop for hospitalization expenses over and above what your group plan may cover. It's interesting to note, though, that if someone is on an HSA plan where they have a high deductible health plan and a health savings account that goes with it, you don't want to sign up for Part A because you can't contribute to that HSA plan anymore. Who signs up for Part B? If you're not covered by the employer-sponsored plan, as we mentioned, then you need to sign up for Part B. That's someone who's not working at all, someone who is self-employed, someone whose employer has less than 20 employees. On COBRA is an interesting thing also. Most people think COBRA is considered employer coverage, but for purposes of Medicare, they do not consider that to be credible coverage. If you are on COBRA and you turn 65, you're expected to sign up for Medicare. Also, someone who is with a company where the benefits are not as good as the original Medicare provides the base level of care, then they will want to sign up too. Who signs up for Part D? Well, someone who signs up for Part A and Part B will also want to sign up for Part D. There, as we said, there's an enrollment penalty if you don't sign up on time. There are two ways to sign up for a Part D plan. One of them is to get a standalone Part D plan. The other way is to get a Medicare Advantage plan. What we saw early on, the Part C, those often will offer and cover Part D as well. So a special enrollment period is another golden ticket. And we said the special enrollment period, the most frequent one is when someone continued to work past 65, then they retire or choose to go off their group plan, then they have a special enrollment period where they can sign up for Medicare. That is going to be 8 months following the time that their coverage ends. It's very interesting and important to know, though, and this is where Medicare gets confusing. You have 8 months to sign up for Medicare Part B. You only have 63 days to sign up for a prescription drug plan if you leave your employer-sponsored coverage. So that's something a lot of people don't realize, but it's important to know. That's another golden ticket, is a special enrollment period. The general enrollment period, as we mentioned also, is at the beginning of the year, January to March. The coverage is not effective until January the 1st. That's the least attractive option, is enrolling through the general enrollment period. Another one that is not mentioned on the slideshow, but everyone should be aware of, is the fact of the annual enrollment period, which comes up October 15th. It ends December 7th. That's why you're going to see a barrage of ads, Joe Namath ads and all the others that talk about mainly Medicare Advantage plans. They are barraging people because this is the time of year when people can make changes. As we said, you have to have a golden ticket. If you want to change your Medicare plan, the time to do it is between October 15th and December 7th, and then the new plan will be effective on January the 1st. So going over them again: initial enrollment period when you turn 65, special enrollment period when you leave your work. There are some other additional special enrollment periods. Sometimes when there are storms and other things, when there's hurricanes, sometimes they will declare a special enrollment period, which gives people opportunity to make some changes. And the third is a general enrollment. The fourth, again, is the annual enrollment, the one that's coming up where they can make changes. How much do you pay for Medicare? Well, most people don't pay anything for Part A. Most people pay zero premium. You qualify for free Part A if you qualify for Social Security, the same way. So you qualify for Social Security by having 40 quarters of earnings credited to your Social Security account. If you have 40 quarters or 10 years of credits, then you also qualify for a free zero premium Medicare Part A. If someone doesn't have 40 quarters, they can buy into Part A. As you can see, if someone has 30 to 39, they have 75% of the quarters, they can pay $259 a month. If they have less than 30 quarters, they can pay $471 a month. kind of expensive, but it is an option. Part B, everybody is going to pay $148.50. That goes to the government and everybody's going to pay it, whether they're on Medicare Advantage or original Medicare, they're all going to pay $148.50. That's adjusted every year. It goes up a little bit every year. This year it was this 2021, $148.50, projected to be $158.50 next year for 2022. Part D, the premium completely depends on the plans. There's hundreds of them and they vary widely. So how much do you pay for Part B? We said $148.50. The fact is that most people will pay $148.50. Most people will pay for $148.50, but it is based on your income. So if we look at the chart, if someone is married and they make less than $176,000 per year, they are going to pay $148.50. However, if you make more than $176,000, you're going to pay an extra, they call it IRMA, Income Related Monthly Adjustment Amount. In other words, it's kind of a penalty. So someone who's making $176,000 through $222,000, they're going to pay the $148.50, but they're going to pay an additional $59.40 for Part B. They're going to pay an additional $12.30 for Part D. So instead of the typical premium $148.50, they're going to pay $260. And you can see the amount goes up all the way to $750,000, where someone's going to pay significantly more. So it's important to know what you will pay for Medicare. Most people will assume that they're going to pay $148.50. That's not necessarily true. They look back 2 years to determine how much your premium is going to be. Some things that Medicare doesn't cover, one of them is long-term care. And I think it's really important to know, many people assume that Medicare is going to cover long-term care. But under the skilled nursing topic that we talked about in the beginning, the only long-term care Medicare provides is a maximum of 100 days and under certain conditions. So if someone is hospitalized, they're in the hospital for at least 3 days, they're released and need some kind of specialized care, skilled nursing, physical therapy, etc., then Medicare will pay a total of 100 days. They pay 100% of the first 20 days. They pay 80% for the next 80 days. And that's the maximum they will pay. The only home care that Medicare covers are visits. If someone has surgery and their bandages need to be changed, they will send a nurse to change the bandages. They may send a physical therapist to do some rehab work. But it's important to know that none of those will cover custodial care. So custodial care being help with eating, bathing, dressing, getting in and out of bed, in and out of the restroom, those things are not going to be covered by long-term care. Care outside the US is not going to be covered by Medicare. Some of the Medicare insurances we're going to talk about will provide some of that coverage, but Medicare does not. Original Medicare does not cover dental, vision, or hearing. You probably heard some things on the news about some of the proposals in Congress are to rectify that and to cover some basic dental, vision, and hearing. But as it stands, Medicare does not cover dental, vision, or hearing. Cosmetic surgery is another one. It does not cover acupuncture. Amounts over the Medicare approved amount, those are negotiated. If a doctor agrees to participate in Medicare, then they are agreeing to take the Medicare approved amount. And then the amounts above what we talked about before on the chart, talking about the deductibles and the copays, Medicare doesn't cover that. So that is one reason why people will have some kind of Medicare insurance. There are two ways to do that. One of them is to keep original Medicare and to keep original Medicare Part A and Part B. Someone will add a Medicare supplement. A Medicare supplement or a Medigap policy is offered by a private insurance company, and those will often pay the deductibles and the copays that we talked about. In addition to that, someone will need to pick up a Part D plan. So someone who's keeping original Medicare will often have Part A and Part B. They will have a Medigap policy, and they will have a Part D, a prescription drug plan. That person is going to pay three different premiums. They're going to pay the $148.50 to the government, to Social Security. They're going to pay a premium to the Medigap Medicare Supplement company, and they're going to pay a premium to the prescription drug company. The alternative to that is to have a Medicare Advantage plan. Someone who has a Medicare Advantage plan no longer has original Medicare Part A and Part B. They are now completely under the care of an insurance company. That insurance company has to provide at least as good benefits as original Medicare. Often they will cover additional things, like we will see a lot of times they will offer basic dental, vision, hearing. They offer some additional benefits as well. Someone who has a Medicare Advantage plan will usually have a Part D included in that. So what they're going to do, many of these plans do not have a deductible and do not have a premium. So many times people on a Medicare Advantage plan, and the reason why they're so attractive is that they will pay the $148.50 to the government, but they will not pay a premium after that. The difference between a major difference between original Medicare and Medicare Advantage is going the option one, the route where you keep original Medicare and have a supplement. That person's kind of paying in advance. They're paying a premium, and then they usually don't pay any deductibles or copays after that. That's the opposite of someone on Medicare Advantage who will not pay a premium, but they will pay copays every time they engage the health system. When they go to the doctor, when they get lab work done, if they're in the hospital, they're going to pay a copay. They may pay $10 when they go see their primary care doctor. They may pay $25 or $35 when they go see a specialist. So it's kind of the difference between paying before or paying as you go along. It's also important to note, one reason why many people will stay with original Medicare and get a supplement is because you have complete flexibility with that. You can go to any doctor, any hospital, any facility in the United States. On the other hand, the Medicare Advantage plan is always going to have a network. It's going to be a PPO network or an HMO network that you have to stay within. So those are two major differences between original Medicare and a supplement and a Medicare Advantage plan. So the Medicare Supplement, in other words, is a Medigap policy. Those you use interchangeably. They are sold by private insurance companies. They cover the deductibles and copays for Parts A and Part B. It says it follows state and federal laws to protect you. That has to go. That has to do with being able to purchase one at specific times. The important thing to know about Medigap policies is when you first sign up for Part B, if you're going to go the route of original Medicare with a supplement, when you first sign up for Part B, you have a 6-month period that is a Medicare Supplement enrollment period where you can obtain a Medicare Supplement policy and not answer any health questions. So someone with pre-existing conditions can get a Medicare Supplement policy. After that 6-month window, that guaranteed acceptance window, then you have to answer health questions and the insurance company can actually turn you down. There are many Medicare supplement policies. This is where Medicare gets really confusing. There are plans A through Plan N. So we know there's a Part A and a Part B with Medicare. Well, there's also a Plan A and a Plan B with Medicare supplements. If we focus on Plan G, which is kind of in the middle here, Plan G is the most comprehensive Medicare supplement you can have. A Plan G paired with original Medicare will pay all the deductibles and all the copays, with the exception of the $203 a year that you pay for the Part B deductible. So it's going to pick up every copay, every deductible, except for that first $203 a year. All of the other plans, A through N, cover something less than what a Plan G offers. The pricing of these plans is set by the insurance companies, and they differ based on what they're covered, what coverage they provide. It's the Medigap policies, the Medicare supplements, what the plans cover. So what Plan G covers is set by the government, not by the insurance companies. The insurance companies can decide two things. They don't have to offer every plan between A and N. They can pick and choose. And the second thing is they can determine how much they're going to pay for it. So what you see is a Plan G with different companies. There's a wide range of premiums. So when working with someone, many times we're saying there's really no reason to pay more than you need to. A highly recognizable name, and we can think of some, is going to have a premium typically, which is much higher than another A-rated company. So that's something to keep in mind. We definitely want to be with a good company, but we don't have to be with a name necessarily. It's going to be exactly the same benefit. The way the Medicare Supplement works together with the Medicare is that the doctor bills Medicare electronically, and Medicare lets the Medicare Supplement know electronically what their portion is. With a Part D, again, it's confusing because there's a Part D and a Plan D, but in this case, we're talking about a prescription drug plan. This is a little bit confusing because for most drug plans, there will be a $445 deductible. That's not true of all of them. 25% of drug costs after the deductible will be paid until you get to a total outlay of $6,550. When you reach out of pocket, but that's the amount the drug company has paid on your behalf, plus what you have paid out of pocket. When that number gets to be over $6,550, then you start paying about 5% of the cost of the medications. Says the drug plans vary widely, and they absolutely do. Not all of them have that $250 deductible. There's a wide range in pricing. The lowest plan that I'm familiar with has a monthly premium of about $7.75, and the highest one is over $200 a month. So the correct Part D plan for someone is determined solely on the medications that they take. When I'm working with someone, we're actually going on Medicare.gov. We are entering the medications, the specific medications that they take with the dosages and frequencies. And the Medicare.gov actually has a very robust system which will say what the most economical plan is and what the specifics of that plan are. So it's not the name, the company that we go by. It's completely based on the prescriptions that you have. Everybody's prescriptions have a tendency to change. That the opportunity to change Part D plans goes along with the Medicare annual enrollment period, as we said, between October 15th and December 7th. So with my clients, I'm calling in this period, this time of year, and saying, has your formulary changed? Or the meds that you take changed? Do we need to shop around and see if we can find a better plan? Medicare Advantage plans, as we said, they are plans that are administered by a private insurance company, also known as Part C. They have to cover at least as much benefits as original Medicare Part A and Part B. Most of them will also cover the prescription drug plans, the Part D plan, as part of it. They may also include extra benefits like dental, vision, and hearing. Those are very frequently part of a Medicare Advantage plan. Some of the other bells and whistles that you see on TV that Mr. Namath talks about may or may not be included on the plan. But again, with the Medigap plan, with the Medicare Advantage plan, my theory is just like the Part D plan. What we need to know is that the doctors that you see are on the plan, the prescriptions are affordable on the plan, and any hospitals that you prefer are on the plan. That's going to determine what the right Medicare Advantage plan is for you. After that, we can look at the bells and whistles. But the most important thing is always going to be, are your doctors, medicines, and hospitals included on the plan? We want to be careful and shop very carefully for private insurance. We want to have an A-rated company. We want to sign up when it's appropriate. For example, if you're going to get a Medicare supplement and you have pre-existing conditions, it needs to be during the initial enrollment period or a special enrollment period when you have that guaranteed issue period of time. The plans do vary widely, especially with the Medicare Advantage plans, and same thing with Part D. So it's a matter of, again, It needs to be doctors, hospitals, and prescription drug plans need to be ones that fit you, that are appropriate for your situation. As we wind down, I want to just touch on a couple of things. One of them is, Medicare is one part of your health care cost in retirement. The Medicare does up a little bit every year. The costs go up a little bit every year. If you're on a Medigap policy, a Medicare supplement, the premiums for that usually go up a little bit every year too. So it's important to build that in to your plan to include the fact that there's going to be escalating costs for those costs. There are other things that can also factor in. We said that they cover even Medicare Advantage. The most it will cover for dental, vision, and hearing are usually basic services. For dental, it's the cleanings, it's x-rays. It may include some fillings, but generally speaking, any major dental procedures are not going to be covered. So all those things are important to know. And especially, as I said before, long-term care, it's just really important to know that it's not going to be covered by Medicare. It's important to sign up for Medicare when you have that window, when you have that golden ticket, either when you turn 65 or when you leave your employer-sponsored plan. Need to be careful and shop carefully for the private insurance, whether you're going with a Medigap policy, keeping original Medicare, getting a Medigap or Medicare Supplement policy, or you're going with Medicare Advantage. You want to be careful and shop very carefully to make sure that the company lines up with what your needs are. And finally, it's important to plan for higher cost and for healthcare and retirement. I'm sure that Hank and the other advisors are very helpful when it comes to that, but it is something that needs to be taken into consideration. And I think, Hank, that pretty much wraps up our quick walk through Medicare. How do we do time-wise?
No, we're doing great. That's great. Thank you very much.
Yeah.
I want to apologize. Jan, I don't think you realize that we were having a little bit of technical issues. It sounded like maybe some of the was breaking up a little bit, so I apologize to our audience for that. I think the main thing I want to get across to the group is that this is a very significant decision that you make when you turn 65 or prior to 65, really. And through our efforts of planning and through our strategic partners, we're here to assist you with this. I had a couple of questions I wanted to run by Jan. Let's say I retire this year and my Part B premium, it actually comes back higher than that $148 that we talked about. And I'm only now getting income from, say, my pension and Social Security. Why is my premium higher, and is there anything I can do about it?
So this does happen pretty frequently. It's because your premium this year is based on what your income was 2 years ago. So if you've retired, your income has probably dropped quite a bit. And so that can be a shock when you get a bill for more than you're expecting. However, there is a mechanism in place. Social Security has an appeal process. There's a form SSA 44, which you can say that your situation has changed. You've had a life change. Your income has dropped, or something else has happened. And they will make exceptions. I haven't had anybody yet who's been turned down for an exception because their income changed.
Great. The other question is, I hear people say a lot of times the Medicare Advantage plan, they really like it. It's a lot less expensive than some of the Medigap plans. If I go on a Medicare Advantage plan and then later decide I want to switch back to kind of the original Medicare with a supplement later, do I have the ability to do that?
That's a great question. And that's one that comes up a lot. Because I hear people say sometimes they're going to go on a Medicare Advantage plan while they're healthy and keep the costs low. But as they age and maybe their healthcare costs increase, then they're going to go back. They're going to switch to the Medicare Supplement scenario. The truth is, you can always move back to Medicare, original Medicare. During this open enrollment we were talking about that's coming up at the October 15th to December 7th, you can choose to go from a Medicare Advantage plan to original Medicare. And that will be effective on January 1st. The thing that's important to know, though, is and we touched on this when we were talking about Medicare supplements. Other than that 6-month guaranteed issue period when you first sign up for Part B, the Medicare supplements will ask you health questions and they can decline you for coverage. So you may have original Medicare Part A and Part B, but you may not be able to get insurance to cover those deductibles and copays that go along with original Medicare.
Okay, all right. And then my last question is open enrollment period. I guess it starts here in October.
Yeah.
What changes can we expect in 2022? Are there any changes coming down? And interesting enough, I think I saw something in the Wall Street Journal that there's even a proposal to add dental care to Medicare. And for some reason, I haven't read the article yet, the American Dental Association is up in arms about it, like they're actually against it. But just curious what we can expect as we go into 2022.
So as we go into 2022, we're going to see some increases. We talked about the Part B premium is projected to go from $148.50 to $158.50. The Part B deductible is going to increase a little bit. The copays and deductibles will increase a little bit. There has been, Senator Sanders, as a matter of fact, has introduced a bill that will have Medicare cover basic dental, hearing, and vision. And so that may change the landscape a lot when it comes to Medicare Advantage, because that's one of the main selling points of Medicare Advantage. That remains to be seen whether that will pass or not, but that is in the works. When you're in Medicare open enrollment period, you can do quite a few different things. You can change if you have a Medicare Advantage plan, you can switch plans. If you're on original Medicare, you can move to a Medicare Advantage plan. That's when you can change drug plans as well. So the annual enrollment period is an important period to be able to reevaluate what you have. And in 2022, it'll be interesting to see what legislative changes come up with Medicare. I'm hoping for go down to age 60, Hank.
Well, listen, this was great. This was very helpful information. I want to thank everybody who was able to join us today. And if you have any questions about going down this road and the decisions that need to make, please contact our office and we'll be happy to coordinate and work with you and work with Jan to get your questions answered. So again, thank you very much for joining us today. And I hope the rest of your day is great. Take care.
Thanks so much.